Thank you for joining me today. I'm Joseph Owen, and today we're going to discuss how to order diagnostic imaging, how to develop a clinical indication that you're going to put on your imaging order, and also how to use appropriate use criteria to determine the best study for the indication. At the end of this session, you should be able to formulate a clinical indication, and you should be able to use freely available tools to find the appropriate diagnostic imaging. It's very important that we select the right test for the right patient. There are lots of risks to inappropriate imaging. One that's in the mind of many patients and clinicians is unnecessary radiation exposure, but there are other risks, such as false positives or incidental benign findings that are going to require further workup, are going to add to patient anxiety, add to increased healthcare costs, and the risk that if you have the wrong test or order the wrong test, that getting the correct diagnosis will be delayed and the patient's outcome will not be as good. Using the appropriate imaging test will help you make an accurate and timely diagnosis that will hopefully improve your patient outcomes and improve the efficiency of the healthcare system. So when you have a diagnostic dilemma and you're planning on ordering imaging, it's really important that you think about what question do you want to answer, right? And that's sort of the basics of the clinical indication, but a clinical indication refers to a very specific thing. So it's not rule out pathology, it's not pain, it's not suspected appendicitis or suspected aortic dissection. So the clinical indication is actually what are the clinical signs or symptoms or already established diagnoses that require further investigation. So when you're developing a good, strong clinical indication, you want to think about the specific symptoms and signs the patient is having and include the duration of those signs or symptoms, the location, the severity, and the character. It is often very helpful to provide relevant patient history, such as a past medical condition, a known current condition, prior surgeries, or any medications, particularly medications that may make someone immunocompromised. And often, pertinent vital sign abnormalities or physical exam findings or lab values are going to be a core to that clinical indication. Specific diagnoses that you suspect or your differential diagnosis is not really the clinical indication, and that's a common misconception that people have. So let's think about some effective clinical indications, right? So let's say we have a person coming in with abdominal pain and we feel like they're going to need some sort of diagnostic imaging to assess that abdominal pain. Oftentimes, we'll get a clinical indication of abdominal pain. And really that isn't sufficient to help the radiologist know what is the real clinical question, what are we looking for here, what is the patient's presentation that necessitates imaging. A strong clinical indication, for example, would be 55-year-old male, presents with acute onset sharp, right lower quadrant abdominal pain for 12 hours. It's associated with a fever, they have nausea, and localized rebound tenderness, right? This is giving us the patient demographics, the characteristics of the pain, including its acuity, its character, and its location. We're giving some essential vital signs like they have a fever, and associated abnormalities, and then a physical exam finding. So when I, as a radiologist, see this in a clinical indication, I am already developing my differential diagnosis, and I know that likely a CT of the abdomen and pelvis with contrast is going to be the right study for the patient. Here's another example. Oftentimes we just get headache. Well, there are many different types of headache, and oftentimes headache isn't an indication for diagnostic imaging. A strong clinical indication would be 30-year-old female, new onset, severe thunderclap headache. Started 2 hours ago, worst headache of life, no trauma. With this clinical indication, I'm already thinking, okay, is this person have a subarachnoid hemorrhage? Are they having a stroke? Do they have meningitis? Right. So I, as the radiologist now, am able to develop an initial differential diagnosis, and I know that the best first test for this patient is going to be a CT of the head without contrast. In addition to providing clinical information that's helpful for the radiologist to make sure the right test is being performed, this also allows for appropriate billing, right? So oftentimes when imaging is ordered, it may need pre-authorization, and an insurance company wants to make sure that the test is truly indicated for the patient. And if the clinical indication is poor and the test is negative, sometimes insurance companies will deny payment, and then the burden of paying no longer will fall on the insurance company, but can often fall to the patient. Another example of a weak and strong clinical indication is shortness of breath. So we get shortness of breath all the time. There are many different forms of shortness of breath, and some of them may require a non-contrast chest CT versus a chest x-ray, or a non-contrast chest CT versus a CTA of the chest, right? So here, shortness of breath is very nonspecific. A good clinical indication would be 68-year-old female, history of congestive heart disease, who comes in with 3 days of worsening dyspnea, orthopnea, lower extremity edema, right? Now I know in my brain that this person likely has congestive heart failure, and we're trying to assess for pulmonary edema, pleural effusions, or maybe a pericardial effusion. And I know that a CT of the chest with contrast is likely going to be the best study for the patient. So let's talk a little bit about the different diagnostic imaging modalities. So there are many different modalities, but to break it down into sort of 5 basic categories, we have radiographs, often referred to as X-rays, right? We have ultrasound, right, which is using ultrasound waves to penetrate the patient and create an image. Computed tomography, commonly known as CT, where we are using radiation to essentially create an image based on the density of the tissue and structures within the field of view. Magnetic resonance imaging, or MRI, where we are using the concentration of protons and their various characteristics due to being bound to water or carbon or where their location is to generate signals that allow us to generate a map of the signals being generated by the protons in the body. And then nuclear medicine. And in general, with nuclear medicine, what we're doing is we administer a radioactive particle or a radioactive substance that will then localize within the patient to certain specific structures, cell types, or tumors. And then we image the patient, and we can see where that radioactive particle has localized within the patient to help aid in diagnosis. So I mentioned appropriate use criteria. So what are appropriate use criteria? Well, they're evidence-based guidelines that are arrived at through a consensus, typically of a multidisciplinary team of experts. And they try to assign the appropriateness of different diagnostic imaging tests to specific clinical scenarios. One of the most common and most well-regarded ones is made through the American College of Radiology, but there are other professional organizations that have appropriate use criteria. And their purpose is to try to improve the quality of patient care, decrease the amount of unnecessary imaging, and ensure cost-effective care. And it serves as a way to educate referring providers or people who are using diagnostic imaging in their patients. And at least with the American College of Radiology appropriate use criteria, the rating systems are often structured on a scale of 1 to 10, how appropriate is something, or more qualitatively, this is usually appropriate, may be appropriate, or is usually not appropriate. To find and utilize appropriate use criteria is somewhat of a challenge. Oftentimes modern electronic medical records like the Epic system will have some sort of support built into them. You can often search the web for appropriate use criteria, and the ACR appropriateness criteria is freely available on the web. And within these rating systems, you can search through and find specific clinical scenarios or specific imaging tests or procedures and see if they're appropriate for your patient. These appropriate use criteria are simply guidelines. They're not rigid rules. And sometimes you will need to deviate from the criteria or guidelines based on specific factors that are unique to your patient. So let's look. If I was going to try to use an appropriate use criteria, again, I'm a big fan of the ACR appropriateness criteria. You simply search ACR appropriateness criteria into Google. It'll take you to this page. You can then scroll down and access the criteria through this portal. When you open up the portal, you can then explore the appropriate use criteria by scenario, okay? And in this case, it's in alphabetical order. So breast, as a organ system comes up first. And for each different type of clinical scenario, you can click on it and then see the different recommendations based on that clinical scenario. You can also explore by more generic, broader topics, right? And again, breast is coming up first because it's first in alphabetical order. And you can see, breast pain or nipple discharge, symptomatic male breast cancer screening, right? All of these topics are there. And if you click on them, it will take you to a screen that shows you the appropriateness of different imaging tests based on specific scenarios. Lastly, you can explore by procedure. So say a CT angiography of the chest, or in this case, a 3-phase bone scan with sulfur colloid, right? That's a very obscure thing to most clinicians. And so if you want to educate yourself on why should I use a specific test, when should I use a specific test, you can look up that specific test and click on it, and it will tell you what different clinical scenarios this test may be beneficial. Now let's explore a specific scenario. So I'm going back to the Explore by Scenario tab, and let's say I have a pregnant patient who has a painful breast mass that's palpable. Well, I, in this case, might suspect that there's a breast abscess, and I don't know what the best next step in their diagnostic workup will be. So I would select breast abscess suspected. And when I click on that, it will take me to the appropriate use criteria, and it'll say, in this specific clinical scenario, an ultrasound of the breast is usually appropriate. It has low radiation, and so that's likely the study you want to start with. Notice that tomosynthesis, which is sort of 3D mammography, or diagnostic mammogram may also be appropriate, but these other imaging modalities are not appropriate for that first-line imaging. If I want to learn more about why it's appropriate, I can click on the narrative, and that will take me to a PDF, And that PDF will provide a summary of the literature. It will then go through all of the different imaging modalities and provide a little background and explanation why it would be appropriate and when. And it also will give us a table of references. Okay, so this is a very nice, readily accessible resource for you to help you when selecting advanced imaging in particular. So let's think about another scenario, right? So let's say we've got a 45-year-old female, 6 weeks of intermittent non-traumatic right knee pain, worse with activity, no mechanical symptoms, mild effusion, and our initial x-rays were negative, right? So it's not clear what the next step might be. We've developed a good clinical indication under that clinical scenario that shortened could just be right knee pain for 6 weeks, insidious onset, negative x-rays. If we go into the appropriate use criteria, you can find knee pain, non-traumatic, x-ray negative. That's a specific scenario available in the ACR appropriateness criteria. And the ACR appropriateness criteria is going to say that an MRI of the knee without contrast is usually appropriate. It will say an ultrasound may be appropriate, but that means it's likely not the best study. But if it's readily available or more available than MRI, it may be worthwhile. But a CT of the knee is not really appropriate because it's not going to give you information about the cartilage, the meniscus, and the ligaments. And so in this instance, once we've had negative x-rays, we can determine that the next best study is an MRI, and we avoid getting a CT or an ultrasound, which may not provide us with as much information. Another thing that's important is to just think of ordering diagnostic imaging as consulting with the radiologist or collaborating, right? So you want to provide that clear, concise clinical indication. That will allow us to know right off the bat whether the study is appropriate or not. Sometimes we'll change the study. Sometimes we'll contact you to put in a different order. And if you really don't know, even if you've used ACR appropriateness criteria, or if you don't want to use it, feel free to call the radiologist for a consultation. This can be very helpful on complex cases, especially when you're uncertain about what to do next. It can also help when an urgent interpretation is needed, or just if you have generic questions about, should I use this modality, or is this the appropriate protocol to order, right? There's a lot of different types of imaging and different protocols for imaging. It's very granular, it's very complex, and we as the radiologists are experts at that and are aware of a lot of the different subtle differences between the different modalities and protocols. And so it can be very helpful if you call the radiologist to get clarification and help understand what imaging is best for your patient. By being thoughtful and formulating a very specific clinical indication based on the patient's presentation, and through familiarizing yourself with common modalities using the appropriate use criteria if you need it, you can hopefully benefit your patients, make the healthcare system more effective, and improve the diagnostic accuracy of the imaging you're ordering. I thank you for your time. I hope you found this helpful, and I would encourage you to always reach out to your radiologist if you have questions, and try using the ACR portal when you have uncertainty about what imaging modalities you need to use.